Okay, so this is the first installment of the chapter on psychological disorders. These are the learning objectives. Describe the medical model, conceptualizing mental disorders. We'll talk about a couple of tools used to conceptualize and diagnose disorders, the DSM and the RDoC. We'll address this concept of comorbidity and the biopsychosocial perspective on mental disorders, and then an influential idea in researching and understanding mental disorders, the diathesis stress model. So mental disorders, these are disturbances or dysfunctions in behavior, thoughts, emotions that cause significant distress or impairment. And you can see from this graph that they're quite common. This is showing the percent of individuals in these different categories that had any mental illness. And overall about 1 in 5. And they're especially prevalent among 18 to 25-year-olds. This, of course, does not include children or adolescents, but relevant to the demographic that's typically in college, 18 to 25-year-olds. So this is probably what a lot of you and others think of when they think of the field of psychology. It's the study of these mental disorders. And in the end, this is what we, as researchers in this field, hope to mitigate and make a difference in, is relieving the suffering that's caused by these. So in this section, you'll see a lot of concepts. In this chapter, you'll see a lot of concepts from previous chapters come up. So a lot of these ideas are applied to these disturbances. So the medical model is conceptualizing psychological disorders as illnesses that have causes, symptoms, and potential cures. So this is definitely a useful way to think of psychological disorders, and it's used by most psychiatrists and most clinical psychologists. The DSM, the Diagnostic and Statistical Manual, connects with this approach in that it's used to make a diagnosis. So DSM, you can see what it stands for there. 5 represents that it's in its 5th edition. The 5th edition came out in 2013, I believe. And before that, it was called the DSM-4, DSM-3, etc. So how is it used? There are detailed lists of specific criteria that are associated with a particular diagnosis. So it's kind of a checklist, and it takes a clinician to make an accurate determination as to whether an individual fits these criteria. But for example, to receive a diagnosis of depression, you need to have at least 5 of the symptoms detailed in the manual. And there are more than just these, but things such as diminished interest, loss of energy, trouble concentrating, feelings of worthlessness or guilt. So you can have different profiles for a given disorder, but all receiving the same diagnosis. So it's definitely a useful tool. There are limitations just because of the complexity of these disorders and individual differences in each one, but definitely a good start. The biopsychosocial perspective tries to kind of capture more of the complexity of psychological disorders, conceptualizing them as resulting from interactions among all these different factors. Biological, psychological, and social. And there may be a given psychological disorder that's experienced for different reasons. So there may be different causes underlying a given psychological disorder. So a little bit different from the medical model in that there's kind of this well-defined cause. The diathesis stress model is an idea that there are predispositions that exist in different individuals that provide an environment in which a psychological disorder could develop if triggered by a stressful event. So the diathesis is a predisposition, and the stress would be an external trigger. So sometimes how this is described is genes and other predisposing factors may load the gun, but stress is what pulls the trigger. If you don't have the predisposition, pulling the trigger doesn't do anything. And conversely, if you have the predisposition but you don't experience the stress, at least beyond some certain threshold, then nothing will happen either. But having both of those in place, this pattern seems to be apparent across multiple disorders, that there are predisposing factors, and then when coupled with stressful events, things like abuse, other illnesses, traumatic events, things like that, then a psychological disorder will be manifest. Comorbidity is a fairly straightforward concept. It's just that you can have two or more diagnoses in one individual. So somebody may have depression, and then they have a diagnosis of major depressive disorder, and then they also have a diagnosis of substance use disorder or addiction. Or you may have ADHD and depression, or bipolar and schizophrenia, for example. This is a common thing. There's many disorders that tend to be comorbid with other disorders. For example, schizophrenia is very comorbid with nicotine use disorder, with smoking. So it's upwards of 90% of schizophrenics also smoke. And these comorbidities suggest that there might be, common underlying factors. There are a lot of similarities between different disorders, even though they may receive a different diagnosis. So maybe there's some underlying foundation supporting both of those disorders. The RDoC, which stands for Research Domain Criteria, kind of gets at these underlying factors. So this is a research framework. This is not something used for diagnoses, but it's trying to guide how mental disorders are classified. It's not meant to replace the DSM, but hopes to guide future revisions to it. And this is something that was developed by the National Institute of Mental Health, which is part of the National Institutes of Health, which is a federal agency that falls under the U.S. government. Okay, so funding for research on mental disorders. The idea behind the RDoC is that can give researchers kind of a starting point, different areas that they can research. So these domains, you can refer to the textbook on what they are, but things like response inhibition, impulsivity, disconnection with reality. I don't know if that's one of the exact ones, but some of these, the inability to inhibit a response, that's something that is common across multiple disorders. Things like obsessive compulsive disorder, you have trouble inhibiting these compulsions, to wash your hands or to bite your nails or things like that. And addiction also, you have these actions that are difficult to inhibit, the use of drugs. So that those two disorders, even though they have different diagnoses, they may find some common themes in the RDoc that apply to both. One thing just to note is there are some cautions that we need to keep in mind in discussing mental disorders. Being too quick to label somebody as, oh, they're ADHD or they're schizophrenic can lead to stigma, hopelessness that, oh, this is just who I am, there's nothing I can do about it, and lead people to not seek treatment. So a diagnosis, it's better to refer to somebody as, oh, they're currently diagnosed with ADHD or they're currently diagnosed with depression, but that doesn't define who they are necessarily. All right, I'm going to conclude now. There are some questions that you'll find at the end of this slideshow, and these slides will be posted on Canvas. Just some questions you can go through to check for understanding, so I encourage you to do that. And that's all.